Hello, my name is Dr. Jeff Aberle, and I want to show you a really fascinating connection that I found connecting tightness from behind the knee to contraction and tightness in the upper neck, upper back, and all the way through these muscles here. This just stunned me when I found it. I think it is the neatest thing, and I want to show the world so they can start using it as well. Now, as you see over here, I'm actually using the Erchonia FX635 low-level laser therapy device. I have a laser there, a laser here, and then there's one up here that's pointing down. It's not as effective because it's so far away, but in this position I could actually do it. Here you'll see another way where I just have two of the lasers going right on specific areas, and I have the middle one turned off. And so if you watch these, you'll see that they actually kind of rotate around a little bit. Get this to work. There you go. So the lasers actually spin around, and they cover the areas that you want, treated. And so what I'm dealing with here is, boy, the easiest way to say it is it's like rigor mortis. And these muscles are very tight, similar to someone that has died, and all their muscles tighten up after death. So it's a stiffening after death that occurs, but it's in a living human being. That's why I call it like rigor mortis, because it's not true rigor mortis. But it's for a similar reason. And I have a different video that I cover that whole reason. I get down to the cellular level. It all has to do with energy production, ATP, and calcium ions, and calcium ion pumps, which take ATP energy. So it's a neat video that explains normal versus rigor mortis, and then what I call abnormal here, talking about one of the areas here, like with behind the knees. So there was a patient that I had, and she had a whole bunch of different body aches, and there's one I just couldn't get rid of, and it was tightness right up here. So I'll just click into this a little more. So she had a lot of tension right up here, and I could feel it. I'd go in there and I could literally push in the joints. If you've ever been to a chiropractor and had your neck palpated, then you know what I'm talking about. It's like tender, it's tight, it's irritated. And a lot of the times you just do a chiropractic adjustment there and loosen that up, and it works. But if it comes back, it might not be that a problem right there. It might be this thing that I'm talking about, so you need to go down and treat the leg with a low-level laser therapy. So anyway, so she'd had this for a long time, and it was the last of her complaints. So I was, expecting this to take longer. But anyway, one day I was kind of at my wit's end, and I just felt around to different muscles, and everything through here felt fairly loose on her. But I came down to the back of the knees, and I'm like, oh my gosh, these things are really, really tight and hard. So I use the handheld, the Erchonia PL Touch laser, to treat this area for 10 minutes. Then I treated this area for 10 minutes because they were both tight. And I came back up and felt the neck, and lo and behold, the whole thing was really loose. I was like, whoa, what just happened? Because that's really surprised me. Now, it turns out I only needed to treat the left knee, but I didn't know that at the time. And I was just finding areas that just didn't feel right on her and working in that realm. So after that, I started looking for this problem for everybody. I'd feel their neck, and I'd feel the back of the knees, and sure enough, if they were real tight on the right side of their neck, their right knee was worse than the left. If they were real tight on the left side of the neck, their left knee was worse than the left. So I would laser whichever side felt tight in the neck. I actually use that as a guide. And why this all happens I'm not 100% sure of. I understand how the lasers work to get rid of this with the energy production and the ATP. But there's certain areas like up here I might have done. In fact, I know we had done the laser up here many a times, and it never gave her as much relief as working the back of the leg did, the back of the knee. So for some reason, this was staying tight almost in a reflexive way versus an energy production way. So she got relief when she do the laser up here, but this changes it in such a better, more permanent way. I just cannot begin to tell you. And so the whole reason why I think this is all connected is you have to understand the anatomy trains concept. Now, this is a concept that you can go look up, and there's a book called Anatomy Trains, and I highly suggest getting this. It's a fun book to read, and it breaks these different lines up. Now, I'm just showing you what Tom Myers calls the superficial back line, and it's from his book Anatomy Trains. And like I say, here's some pictures here. I don't want to go into them. I'm going to break any copyright laws. But you can look at that on your own and peruse that up. You just type in anatomy trains, and anatomy trains will get you to the books and or to the book. There's 3 versions as of this recording. But that's what's going on. So here I am showing the superficial back line, and it goes from the foot, from the plantar fasciitis area to plantar fascia and some of the deeper muscles of the foot. And just gotta wait for this to save here. And then it goes up the back of the leg, the lower leg, calf, gastrocnemius and soleus muscles, and then into all 4 hamstrings, up through the sacrotuberous ligament, okay, and then up the erector spinae muscles all the way up to the neck, and even the deep muscles here in the neck, okay. It also includes the multifidi and rotators throughout the spine. These are the tiny little muscles that connect from vertebra to vertebra. So again, you can read that in the book, but you don't even need to know that. As long as you kind of see this general vicinity of what's going on. You use the lasers down here and things change. Now, are there times where I work the leg and I can't get it to loosen up here? Absolutely. Then I know I got to go do this. So if I work the leg, and like say somebody comes in and they have upper back issues, okay, they hurt up here, and I go to the leg and they don't feel any different. Okay, I do the laser down here for 30 minutes and they feel no different up here. Well, this probably isn't the area then. I just have to laser directly on it. But then there's been other times where people come in with tightness up in here, and I just laser this and nothing happens. And I laser and laser and laser and just nothing changes until I come down here and do this. Then this changes. Now I might have to go back here and do more laser and after the fact, but the focus changes. So I use the laser, believe it or not, as a differential diagnostic tool. It allows me to tell what areas really need the work and what areas don't. So as you know, some people would obviously be very depressed if I worked an area and it didn't change them, but then I learned that that's not the right area. Or it's just so bad, like say they've had a little bit of change, but it came back, right? If they had a little bit of change, even for a few hours or a day, that doesn't rule out the area that I worked as being a golden area to get on them. It just depends on how tight they are. There's so many variables. What I'm trying to show here is not all the ins and outs of this. I'm just trying to show the importance of lasering this spot of the body, which again never hurts people. It never hurts people. Unless you have what's called a Baker's cyst, and that's a fluid-filled sac back here that hurts. So here I am using the laser on this leg, and here again, went over that, and these do rotate around. And in this video here, I'm showing her how this is all connected. Now she came in not with right knee pain; she came in with upper back and neck tightness, and her whole testimonial is right here, right on my YouTube channel. And so as I'm working on her knee, within 10 minutes, this was all starting to loosen up. I believe it was 10 minutes. It's usually faster than that, people can tell. It just depends on how bad they are in the knee and how much this is being correlated to that problem in the knee. But the neck can loosen up and people can tell the difference really quickly. It's very fun. And here's another testimonial we have, and this is where I was working. Now, this woman too, I also did the front of her hips, and so she's talking about that. But afterwards, she's talking about how her neck was so much looser. If people have knee problems, this is a great area to go to as well. Most people, when they hurt in their knee, they don't hurt in the back. They hurt in the sides or the front, right? And but working the back and loosening all this up here helps all those areas. Now, what's going on here is you got to understand this is how cool this really is. I'm just going to use this as a rotation point here, and I want you to look at. There's 4 hamstring muscles coming down here. So there's 2 on the outside, and then there's 2 here. You got a real thick one underneath, and then a thinner one here. So you can see the thick one there. Okay, you see that geometry? So there's the outer one, and then there's the inner one. Okay. So this one here, by the way, just doesn't continue to connect up through the line, but these 3 do. So he talks about that in the book. But what I want you to gather here is how the gastrocnemius heads go underneath the hamstring tendons. And underneath the hamstring tendons. So you can kind of see this, how well, you can't see the underside there, it's covered up, but on this side you can see it. So you see how this works here? So it goes up behind that and underneath here, and it hooks around. I mean, if I highlight this, you'll see it behind how much it hooks, and then you'll see how this hooks underneath as well. So what you get here is you get this really tight rigor mortis type feel, And over on this side, it's usually much wider and taller, longer. So usually this whole area needs to be treated. And over on this side, you usually just get a almost like a marble that you have to get. And the marble can take some time to break down, okay? And these marbles do loosen up. And if they don't loosen up, it could be partially because there's just not a good blood supply to it as well. And you can laser it and laser it and laser it, and it will slowly change. But sometimes if you've done this for a really long time and it's not changing, just give it some time. And I'm talking weeks to months, and that thing might start loosening up on its own. But again, this really isn't showing the ins and outs. I just want to, for those of you that have lasers, I just want you to kind of know about this, because there's a lot of people that have the Erchonia lasers out there, but they don't know this trick. And it really is, it's not really a trick. It's just something that's just I accidentally discovered. So this here, you have a wider area of influence. The other thing that's very neat is this correlates from inside to outside, and it correlates from inside to outside. So in anatomical terms, you call it medial to lateral, and then medial to lateral here as well. But if someone's really tight along the inside and not so much here, well, if it's along the inside, you kind of know to go work the inside of the knee. If it's along the outside of these muscles, like through here, you go work the outside of the knee. So the lines, the fascial lines, don't spin around here and crisscross. So outside doesn't become inside, outside here doesn't become inside here. It's kind of like this one-to-one connection, right? And that's how that works. And you will be amazed how fast things change. Now, when I first learned this, I was using the handheld machine, which works great. It just might take a little longer, and it depends on how many heads you have on it. If you only have the Accelerate machine, there's only 2 lasers on there, so you're gonna have to do one side and then move it to the other side. No big deal. It still will work. And again, feel down here. You can feel this changing as you're working on it, which is really, really fun to see and notice. So if you're at a seminar, an Erchonia seminar, or if you're at, or if you know somebody that has this, or you know a doctor that has these Erchonia lasers, and you haven't tried it on this, then give it a try. They can watch this video, just send them the video, and they can take a look at this, and you'll see. And what's really fun to do is just do one knee for like 20 minutes, 30 minutes. And then you'll see the relative tightness in your other knee, because you haven't done that yet. So you don't even realize how tight you are in your knees, because it doesn't hurt. You just don't even notice it until you loosen it up. And once you've loosened up a side, then the other side feels relatively tight. It's really fun to show people this, and it kind of freaks them out. They're like, wow, I didn't realize I was that tight there. I'm like, yeah. And then the knee you did do is really loose, and sometimes you can get it so loose it just kind of feels weird for a while, and you're like, whoa. And then it becomes your norm. Then whenever that looseness is, feels like it's just that's your new norm, and you're good with it. And then you can continue more if there's still more issues there. But this really does feel hard. In fact, the tendon, you won't even notice sometimes until you start loosening up, and then you can actually mush into this bigger muscle here, and now you can actually feel the tendon. It just stands out really easily, and same with over here. You can feel these things better. Now, this isn't really an area you can massage. It just doesn't work very well, especially trying to do it on yourself. It's hard to even laser this on yourself, and you don't have to do anything, but by the time you've bent forward and feel your knee in a stretched position, all your hamstrings just get real tight, and you just can't do anything on your own here. It's annoying, but the massage isn't really the thing to do here anyway. Once you watch the rigor mortis video, you'll realize that this is an energy production problem. Massaging won't fix this, because the cells have to change, and the mitochondria have to be re-enabled to make energy again. And again, I go through that in my other video. But the laser in this produces the really good results. And massage therapists are even told to stay away from this area because of the blood vessels and the vascular or the nerves that go through this. And it's not an area you can really loosen up anyway with your hands. It's just too tendinous. It just doesn't work well. So don't try to loosen that up with your own fingers and thumbs. It just won't work because you're bent forward and all the hamstrings just pop out. It just will not work for you. But it is a key area to get a lot of these other things to loosen up. So I think that's all I had to cover. again, just trying to get this out to the world so people can try this and see this connection. I think this is going to change a lot of people's lives. And hopefully this becomes a norm, a standard of care in our society. Because lasers, when you talk about low-level laser therapy, 99.9% of the population are like, what? What's that? But over in Russia, they've been using low-level laser therapy since 1974. So they are way ahead of us in terms of research for low-level laser therapy. And most of the other countries back then just went different routes. And our country seems like it went the pharmaceutical route. We were looking for drugs to try to solve our problems. But the low-level laser therapy is safe. There's like no side effects. It's amazing. It's amazing. And what it does is it rejuvenates the mitochondria in your cell to make energy, which gets rid of the rigor mortis effect. It's just this rigor mortis-like effect, I should say. And very amazing. So there are other lines. This is just one of them that I'm going to go through. And so like say you're not tight in the back of your neck. Say you're tight out here in the traps or the side of your neck. Well, that's a different line. And so I'll show that in a different video, but I wanted to get this one out because I had this one done. And I think that's all I have. So if you have any comments or questions, leave them in the comment box. Again, I'm just doing this to try to get the information out there and just expand. So hopefully people can expand on this and really show that it's correct and it really changes lives. And that's the whole point, is to change lives and get people out of pain as soon as you can. And the low-level laser therapy is an awesome, incredible way to do that. So anyway, that's all I have. Again, my name is Dr. Jeff Aberle, and thanks for watching.